At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live, and I got another great program for you, kind of follow up of what we've been doing, and hopefully I've got your attention about what happens when you smack your head and the symptoms of brain damage. We're going to talk a little bit about the progressive onset of neurodegeneration of your head and the peripheral nervous system because of trauma, because of things that happen. And we'll talk about what kind of trauma I'm talking about in a second. But having said that, I want you to really assess what's taking place over time. You know, so many of us, if you will, are fearful of losing our cognition, not recognizing things, not knowing who's out there, forgetting very simple tasks. And, you know, you read the literature and they're going to say that, well, what do you expect for your age? Well, I don't know about the rest of you, but I'm working really hard to maintain a very acute sense of discernment and being able to continue to learn and compile information. You know, we work really hard, and then there's a lot of us that say, okay, it's time to retire. But retire to what? Unless you have something that's going to stimulate your body's ability to assess and be able to develop and learn and so forth, you're going to see things go down the tubes. Just very much like if you were an athlete at one time of your life, whether you were a professional athlete or you were, you know, just a high-level college athlete, or you were just, you know, the weekend warrior, but you were good at what you did. Now you're getting older, and for whatever reason, life gets in the way and you stop. What happens? You start losing the capacity to be able to do what you used to do. And as it age, a lot of us say, well, it's because I'm getting older. No, it's because you stopped doing what you're supposed to be doing. The body has an amazing ability to forgive virtually anything, providing that you don't let go, meaning stop doing what it was you were doing. Now, it takes a little bit more effort as we get older sometimes, because, you know, we need different types of input. We have to get off our derriere. We have other thought processes. We have other things that are consuming our interest and our attention. But if you get to the place and you really understand that you can reverse this, particularly when it comes to your brain, and that's what we're going to talk about today. We're going to start the process of learning about what happens with onset of trauma, and then does it induce what? Can it induce things like impaired memory? We're not talking about totally don't know who you are anymore type of memory loss, but that can come down the point. But just forgetting simple things. What was that word that I was thinking about? You know, and you start searching for things. Stress patterns will do that as well, but we're talking about trauma. We're going to talk about concussive patterns, concussion, trauma to the brain, to the sensory motor system. We begin to lose the ability to deal with high levels of executive function. Means decision making, quick, attentive decisions. Someone will say, well, I've never been able to make a damn decision my entire life. Well, it gets worse if you don't take care of things that have happened to your head. How about in the emotional instability? You're just like, you know, you're reactive. And where you were pretty solid before, things really didn't get to you. Everybody has that moment, but you really didn't react. Now you react to virtually everything. So you start seeing these subtle changes that are really related to trauma-induced neurodegenerative changes due to concussion. And when we're talking about concussion, we're talking about getting that noggin of yours, that skull banged at some level. You could be sitting as a passenger in a car and somebody rear-ended the car. Your head ricochets off the bony structure of your skull, and that can conduce to trauma. You got into a fight when you're a kid. You didn't think too much about it then, but over time, that one area that you took the hit in now is affecting the areas that it controls because we didn't adapt well enough. We have ongoing inflammatory reactions that affect the brain. We were talking in the last program, I said that we have lymphatic drainage to the brain. Years ago, we didn't think we had. Now we know, in fact, that there is a lymph system that gets rid of debris and garbage and inflammation and so forth that has to do with the brain. It's called the lymphatic system. So, just kind of put these things away, and I'm going to start tying them together a little bit. But when you're talking about the symptoms of brain damage, things that can take place, the types of brain damage that occurs, it can be quite significant. So a traumatic injury, a blow, shaking, strong, quick movement of your head, rotational injury, like, when you have a car accident or a sudden whipping action of any sort. How about if you get into a roller coaster and you're not sitting in there the way you should? There's a whipping action that occurs. If you do that repetitively over and over and over again, there's an argument that perhaps that can cause irritation to the nervous system. So, if you look through, you're going to see things like closed head injury. You're going to see a concussive pattern. But concussion is really what we're talking about because it comes about from all of this. Contusions, that's a bleeding, something that goes into the head, God forbid, a bullet or a knife or whatever. And, we've talked about in the last couple of programs, we talked about even shaken baby syndrome. So anything that causes the brain and the sinews of the brain, the attachments, if you will, to be irritated, subsequently causing inflammation, swelling, lack of connectivity, if you will, from one nervous system to the other. So there's acquired brain injuries, and some of these things are they have hereditary attachments that can cause the onset, if you will, of neurodegenerative conditions. What am I talking about? How about a stroke? Now, stroke is a loss of blood supply to the brain, or it's a bleed within the brain, and it can be a result of a clot or anything like that. So that can cause a concussive pattern-like presentation. Is it a concussion? Not by the true definition, but the symptom process is the same. You can have this heavy blow. I think it was my senior year in high school, and I was taking earth science, and the guy that was teaching the class, all of a sudden his eyes got wide open. He was at the chalkboard. His body almost like was thrown back against the board, and he hit it and then hit the floor. He had a stroke, a massive, massive stroke that acted as if it was a blow, a trauma to the head. By the way, by the time he hit the floor, he was gone. He was dead. You have tumors, space-occupying lesions. A tumor can be, obviously, it can be a benign tumor. It could be a cancerous tumor. It can be a water compartmentalized, and I use the word water, fluid, that is encapsulated and that puts pressure on tumor-like type of situation that has to do with an old injury that takes place over many, many years. The infections, the Lyme disease, the viral patterns, the stuff that we just went through with COVID, it's affecting brain in a way that it's representing all the symptom processes if it was a trauma or a concussion that occurs. So don't think, by the way, that it just happens to football players and soccer players and basketball players. And, it also happens to all of us that get into a tussle with somebody, maybe when we were a kid, but falls and any kind of shake or trauma. Now, here's something that you may not have thought about. How many of you, when you sneeze, hold your breath? When you cough, you hold your breath? Some of those motions, if you will, or those mechanical patterns will cause the head to have pressure in it. That pressure is induced by you, and it's not on purpose, but it can cause all kinds of situations. How many of you dive deeply into the water and you forget to decompress? I'm a diver. I have a master's tag. I've been doing it for years, and I get really low, and I can't ever, forget that I have to decompress in multiple stages going up, particularly based on the length of time that I was under there because of the high levels of nitrogen. That also can cause a problem. But let's talk about this onset of neurodegenerative conditions that show up. So a TBI, or traumatic brain injury that's associated with trauma, ultimately increasing the risk of neurodegenerative diseases, is significant. And it any other means by 1.5 times. And it's been estimated that about 5% to 7% of all dementia cases throughout the world are attributed to some sort of traumatic brain injury. So we're talking about significant amount and numbers of people, particularly when, we see all these things, these ads that say, you're getting older. This is not something that has to be experienced by you if you understand what the symptoms are and what you can do about it. So here's something that, when I was kind of prepping for a class I was presenting, this goes back several months ago, that I read an article and it talked about any kind of ongoing pain, severe pain at the back of the head could act as if it was a traumatic induced concussion that was producing other problems. Now, if that was the case, then you have to understand that sometimes if we don't understand, we don't pay attention to what's going on, and we don't act fast enough, then we have a problem. So what's the problem? Why, if we ignore the back of our head pain, that we could begin the process of neurodegeneration or something that's going to predispose or act like concussion? So again, let's go to what a concussion is. A concussion is an injury to the brain, to the nervous system, the central nervous system, meaning the brain in that initial place of the spinal cord as it goes into your spine. But that pain, that pressure, that irritation, that dull headache could be a signal of several things. It could be a signal of swelling that's caused by something. Could be the off-centering of the vertebrae at the upper part of the neck, cervical 1, cervical 2. It can be a shifting of the skull on the neck itself, causing swelling, irritation. And again, we're talking about a traumatic irritation like presentation. Now, could it be that trauma of years ago caused it? Perhaps. Could be partial. It could be many different little pieces of the puzzle. But let's talk about what we're dealing with. When that back of your head is irritated, there are a lot of nerves that originate from there, like the nerves that go to your eyes, the nerves that go to your ears, like the facial nerve of expression. But a major one, that's the most important one, is the vagus nerve. It's the 10th cranial nerve. Now, that cranial nerve, the vagus, has different divisions. One of them goes directly to the heart, and it controls the upper chambers of the heart and initiates the normal contraction of the atrium to the lower portion of the heart called the ventricles. So if that vagus nerve has been irritated due to swelling, irritation, initial trauma, it can act just like a concussive pattern that would cause those symptoms to occur as well. So any kind of old car accident, any kind of postural irritation can cause swelling at that lower portion of the brainstem, causing that vagus nerve to be irritated and swollen. So the communication isn't normal. And now you have cardiac symptoms and misfiring. And you go to the doc and he says you have atrial fibrillation. So that's one of the major presentations, believe it or not. So any kind of lifetime head trauma has multiple presentations. And that's the thing that we really want to look at today. Head trauma is a very significant risk factor for multiple neurodegenerative diseases. And I said multiple, many different types of things. And you can have more than one. You can have Alzheimer's, you can have Parkinson's, you can have something called ALS, God forbid, Lou Gehrig's disease, amyotrophic lateral sclerosis. You can have chronic traumatic swelling. It's called I can't even pronounce the word. It's called encephalopathy. And, or you can abbreviate it like everybody else does, like CTE. And by the way, that's the only neurodegenerative disease occurring almost exclusively in individuals with prior repetitive head trauma due to something. And it could be anything. It could be having been in the military, where you're in combat, you're learning, you're hitting the ground, you're doing all those things. We see a lot of this with guys, that have been in the military for a lot of years, have been deployed multiple times, but just going through boot camp. Think about it. I spent, 2 summers, 6.5 weeks each at Quantico, Virginia. And some of the things that occurred back in the day, the Vietnam years and so forth, were very interesting. Many of you know what I'm talking about. So when that builds up over a period of time, you're going to be diagnosed with a suspected neurodegenerative disease. They don't know what quite it is yet, but they're suspicious that there's a problem. But what do? Well, let's watch and wait. Well, there's a lot of things you can do instead of watching and waiting, and to be able to decrease the swelling, reconnect things very much, like you would do anything. That is, if you have a wrist that's swollen, an ankle that's swollen, you want it to work well. So you have to implement certain situations. Structural magnetic resonance imaging, or MRIs, they're routinely performed in clinical settings to rule out neurodegenerative anything, but mostly with mass lesions like strokes and things of that nature. The problem is that it doesn't necessarily pick up the initial problems with repetitive injury, right? So when we have things that begin to present themselves like, oh my God, they might be in the initial stage of Alzheimer's, or primary progressive aphasia, if you will, like, our dear friend Bruce Willis, and he's gone into a very significant form of that, and behavioral problems with executive function. It's the frontal portion of your head, where your forehead is. Any kind of trauma, then all of a sudden, you start seeing shrinkage of the brain. You start seeing process of protein. They call it, I think the term that they use is called protein misfolding and deposition. That means the protein molecules get in there and they get in the wrong places, and they begin to cause dysfunction in the glial cells and so forth. Then pretty soon you end up with these tumor-like situations. But what happens is the synaptic transmission, the triggering from one part of the neurological endpoint to the beginning of the next becomes slower, and we get to see the sluggishness that occurs over time. It's a really interesting area, and we're starting to see more and more literature that says, hey, we're missing the boat here. And everybody's been finger pointing towards heavy metal toxicity. They've been, the environmental stuff, radio signals and so forth. And all of those things have the ability to cause what we're talking about. But at the end of the day, we want to make sure that we can identify it early enough and be able to resolve it. When I get into the live stream program, immediately after Dr. Tom Roselle Live, we're going to go into the Ageless Health live stream. And by the way, those of you who want to join us immediately, and please do, just go to drtomroselle.com and click there, and it'll take you right into it. And make sure that you follow me on any and all the social media sites, because you'll be notified exactly when we go on and we do any kind of live anything. It's important that you arm yourself with as much information as you can. Remember, I've always said to you, your health is a do-it-yourself program. It's in your hands. But the only way that you can do that is you have to make sure that you have the knowledge, the background. And that's why I do this, is I want to give you as much information as I possibly can. So we'll get into some of if you see this, we have to begin to think about this, because if it goes too far, then we have a problem. It's not about drugs. It's about, can the body repair itself? Can it begin to reestablish normalcy? Or are we suffering a permanent loss of communication in the brain and swelling and irritation to the point that our memory goes, neural behavior is from the neck down also is altered, very much like in a Parkinsonian problem, which is the lower portion of the brain. Is our executive functioning just kind of gone out the window where we used to be really good at it? Do we suddenly become impulsive and explosive, and we have all kinds of rage behaviors? Those are neurobehavioral syndromes that can come as a result of concussive patterns. We see athletes that have been repetitively banged in their head, or people who suffered some type of brain, but their personality is not the same anymore. And we say, my God, what happened to him or her? That's part of what we're talking about. Now, there's many other reasons. We could sit here and talk about the drugs and the chemistries and so forth. And trust me, I could talk to you about this all day long because we see it all the time. But when you see an adult that suddenly was a very happy-go-lucky, very engaging person, and now they're depressed and they have anxiety and they have headaches, and it's not like them, we have to begin to ask questions about what happened, over many years, not just a week ago or 10 days ago or two, not even when the symptoms began, but even a decade or two before that, or three. What happened early on? So the definition of the underlying why has to be added to how often, the severity, the timing, what triggers it, and so forth. Is it permanent now, or is it something that could, and then added also to the drugs, that they may be taking that could increase the severity of what we're dealing with. So make sure that if something's not right, if you notice that you're changing, look at your background. What's happened to you over a period of many years? Were you in the military? Did you play sports? Did you have some car accidents? Did you bang your head on things? Did you bump into people, and you all of a sudden you say, well, I got the Klutz syndrome. Maybe not so much. Maybe that there's something else that's there, that's a repetitive head trauma that has taken place slowly, subtly over a period of time. But when we get into the live stream program, we're going to talk a little bit about the different ways that not only that we can recognize and diagnose repetitive trauma and the potentials of these things happening, but also what might be available in wavelength frequencies and different types of fixes, if you will, that may say, hey, there's a way out of this thing. And as long as you have part of your nervous system intact, you can begin to reverse virtually anything. So it's important that we understand that these pathologies, if you will, that are post-trauma, that can cause an increased risk up to 5% of the population of these neurocognitive changes. And we can go back and we look at athletes who would happen. One of my favorites is a guy by the name of Muhammad Ali, right? And what happened to him with Alzheimer's as his life ended. It was ugly. It was not. Here's this amazing athlete, and he took some blows later on. He wasn't able to dodge and parry and rope-a-dope the way he used to, but he ended up in a bad place. So we're going to talk a little bit more about that. Join me immediately after this with Ageless Health live stream. And all you have to do is go to drtomroselle.com, click the banner, and it'll take you right in, and we'll make it happen together. Just remember, I'm here every Sunday on an ongoing basis, to make sure that you have education, to make sure you have information. And, if you ever want to send me a note, please do. All you got to do is go to drtomroselle.com. You go to Roselle Center or Roselle Care as well, rosellecare.com. Or you want to talk to one of our doctors right away, 703-698-7117. Let me know. I'm here to serve you. I'm here to give you the information and do whatever I can possibly do to make your life better and get you out of the fear pattern and give you the tools to be able to resolve things that might be happening. Remember, I'm here for you on an ongoing basis for one reason only. I love you all. Have a great Sunday. We'll see you next week. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Long-Term Effects of Head Trauma and Concussions on Wednesday, October 9th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.